Hi, my name is Carolyn Colman, and I'm a rising senior at Jones College Prep in Chicago, Illinois. My school is in the middle of downtown Chicago, and before the pandemic, I would take the train to school pretty much every single day. To give you a little bit more background on me, I have lived in the city my entire life, and I absolutely love it. In school, I am the current junior class president, incoming co-president of my school's chapter of Best Buddies, and co-captain of my school's girls golf team. I also wanted to get a little bit more involved with my culture. I'm half Korean, and I co-founded the Korean Language and Culture Club with some of my friends at school. Outside of school, I love to hang out with my dog, Paws, who's in this picture, walk around the city with my friends, and also read. I also absolutely love music and have been playing piano and violin for over 10 years. In terms of career plans, I cannot wait to study neuroscience in college, and I hope to someday be a neurologist. My presentation today is on the global opioid crisis with a closer focus on the United States. And so I was first introduced to this topic in my AP seminar class where I learned about it with some of my classmates. And I became really interested in the opioid crisis as a result of my preliminary research. And I've actually been spending some of my time over the quarantine to learn more about it. So in my presentation, I will be briefly talking about the crisis as a whole and how it pertains to global health, and then discussing a possible solution based on my research of the genetic factors of opioid addiction. So here are some statistics to give you a little bit more background on the opioid crisis in America. So over 130 Americans die every single day from opioid overdose. And as you can see from these other statistics, this is largely due to prescription opioids. If I had more time, I would go into the legislative factors and prescribing habits of doctors, but due to the limited time, I'm going to be focusing on genetic factors today. So while the opioid crisis in America is unparalleled by any other countries such as South Africa and Mexico have shown worrying indications of potential opioid crisis. So according to the World Health Organization, because of their capacity to cause respiratory depression, opioids are responsible for a high proportion of fatal drug overdoses around the world. So this problem is not isolated to just America and the two other countries that I mentioned, but truly is a global health issue. The issue of opioid abuse is especially significant because opioids are so widely used. In fact, according to the United Nations, there were an estimated 53.4 million past year users of opioids globally in 2017. And this number is affected greatly by increased prescribing habits of doctors and loose legislation surrounding this. So moving on to my research on genetic factors, what most people do not realize is that after a certain period of exposure, every single person will become dependent on opioids. However, only a small percentage will actually become addicted. And so the difference between dependence and addiction lies inside the OPRM1 gene, which is responsible for the pain, pleasure, and reward response systems of the human body. The potential heterozygous allele for this gene, A118G, is the rarest combination. However, while it is the rarest combination, possession of this allele has a high impact on one's susceptibility to opioid addiction. A study conducted in 2006 showed high prevalence of the A118G variant within those affected by opioid addiction, which highlights the clear causality of this gene on one's susceptibility to opioid addiction. The study concluded that 88% of those in the study with the heterozygous allele were addicted to heroin. Additionally, this allele was present within 91% of heroin addicts included in the study. So based on my research and these staggering statistics that clearly highlight the influence of this gene on addiction, my proposed solution is to implement genetic testing. The OPRM1 gene's heterozygous allele has a clear causality on one's susceptibility to opioid addiction. So this gene testing would be mandatory and one would not be able to be prescribed opioids without passing these tests. While there are other potential solutions, for example, preliminary trials with methadone maintenance therapy have shown varying levels of success in South Africa, it would be more effective if addiction is stopped before it even has the opportunity to occur. While genetic testing's focus on preventative measures may seem less ethical or moral than solutions like rehab, which focus more on helping those already affected by addiction, a high percentage of people in rehab actually experience relapse, which not only highlights its ineffectiveness, but also that the money could be better distributed to implementing these pre-preventative measures. This testing would not only reduce opioid abuse and save people's lives from the destructive impacts of opioid addiction, but also make opioids more accessible for those who are truly in need of them. If this testing was implemented, these preemptive measures can help ensure that the opioid crisis does not continue to spread around the world. So here is a list of the sources that I found in my research that helped me develop the solution of gene risk factor testing. And then I would really like to thank my AP seminar teacher, Mr. Gunnick, and our school librarian, Mr. Feely, for helping me find reputable sources. I also want to thank my classmates who helped make research more fun, my parents for their encouragement and support, and thank you, of course, to the organizers of the Global Health Leaders Conference for all their hard work to make this opportunity possible. And thank you all so much for listening. And please feel free to reach out with any additional information or questions. My email is written right there on this slide. Thank you.